We're still not out of the woods yet. This is what the CS is terming that the worst month. 274 deaths, 14,927 infections is just 1 month. This also led to 18 deaths in just 24 hours and 559 cases. That is a positivity rate of 18.2%. That then brings the total number of infections here in Kenya to 70,804. Part of the deaths there were a female Form 4 student at Lureko Secondary School in Mumias East constituency, who has become the first school-going student to have succumbed to what is suspected to be COVID-19 complications. Faith Ngina is said to have succumbed on Friday while receiving treatment at Lifecare Hospital in Bungoma after developing breathing complications. The case coming as Health Cabinet Secretary Mutahi Kagwe termed November as Kenya's darkest month, where close to 15,000 cases have been recorded in just 15 days. Kagwe has more details.
It is at this school, Lureko Secondary School in Mumias West, that Faith Ngina, Form 4 student, was studying. Ngina was taken to the Lifecare Hospital for treatment after developing breathing difficulties. She is said to have passed away on Friday. Kakamega County health officials suspect a possible extended chain of transmission as the girl was a day scholar and the parents had tested positive for COVID-19, had been hospitalized, discharged and were undergoing treatment at home. While a post-mortem may unravel the mystery, reports indicate that Ngina's body had already been embalmed and it remains unclear on how this will impact the search for crucial answers. While addressing the 237th brief since the first case was reported in the country, Health Cabinet Secretary Mutahi Kagwe said they were investigating the matter and would not hesitate to take drastic measures to avert a possible crisis.
We have said we will take serious surgical measures so that if there are infections in any school, we will close that institution. And on schools that don't have any infections, then we do not have to close those institutions.
The COVID-19 situation in the country continued to spiral from bad to worse.
This has been the darkest month since March, when the pandemic struck.
According to Kagwe, since the beginning of November, close to 15,000 new cases have been recorded, with 274 others losing the battle to COVID-19. The second wave of the virus appearing to ravage the country harder, pushing the government to review its strategy. A meeting with the National Emergency Response Committee and the Doctors Union KMPDU resolving to develop county-specific containment measures in light of the established community transmission.
The attack rate in the country is different now from county to county, and it may be necessary to take measures within counties that we are not taking in other counties.
This prompted by increasing number of cases in the counties. With the virus having also hit frontline health workers hard, 8 doctors, several clinical officers and nurses having lost the battle, the government moved to appease the soldiers at war. NHIF was directed to by Tuesday expedite the process of developing a comprehensive cover for the health workers.
In consultation now with the unions, the doctors' unions, we have instructed the National Insurance Hospital Fund to quickly conclude the negotiations for comprehensive group life, last expense, enhanced work and injury benefits, and group personal accident cover for COVID-19 as approved by the Cabinet, and announce the conclusion and effectiveness of those insurance benefits tomorrow.
And even as he directed law enforcement agencies to deal with those defying the set-out protocols, Kagwe pleaded that to beat the virus and stay ahead of it, personal responsibility was key.
Kenyans, please, don't go to those rallies. Do not attend those rallies. If you go to those rallies, you will fall sick.
With a worrying rise in the number of new infections and as the government makes efforts to control the pandemic, in order to succeed, it is calling for coordinated effort from Kenyans through strict adherence to the infection prevention and control measures prescribed. Kagwe, Citizen TV, Nairobi.